Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Glad that you could join us today. Our guest in studio today is Barby Ingle. She suffers from Reflex Sympathetic Dystrophy, or RSD, and endometriosis. She's also a chronic pain educator, patient advocate, motivational speaker, best-selling author, and president of the Power of Pain Foundation. And she's here today to talk with us about chronic pain, her personal journey with chronic pain, and how her foundation is raising awareness of chronic pain. How are you doing today, Barby?
I'm doing okay. Thanks for having me.
Thank you so much. As a sufferer of chronic pain and also a best-selling author, could you talk a little bit about chronic pain that you're dealing with and have been dealing with, and also about your latest book?
Sure. Well, I've been suffering with chronic pain, as you said, endometriosis, which is a female problem, since 1997, and then I developed Reflex Sympathetic Dystrophy in 2002. Most people have heard of endometriosis, so I'll tell you a little bit about living with RSD.
Okay.
It's a progressive neuroautoimmune disease. It affects multiple systems of my body. Reflex is everything in your body that's automatic, so swallowing, blinking, tears, intestines, heart, everything that's automatic goes haywire. Sympathetic involves my sympathetic nervous system, and dystrophy is loss of muscle and bone and weakness. So that's how it lays out, and it affects my life in a great number of ways. I'm actually doing pretty good now compared to where I came from. I was in an auto accident in 2002, and that 8 seconds changed my life. And right away, I had the burning fire pain in my face, neck, and shoulder after the accident. It was different than any other pain I experienced. Prior to my accident, I was the head cheerleading and dance coach at Washington State University and for 8 years. And I always thought, I was an athlete my whole life, and I always thought anybody can get over pain. It's a matter of just wishing it away and suck it up, put an ace bandage on and get back out there. This was something that was incredibly different that I'd never experienced before. And the burning fire pain, and I started, going to doctors, chiropractic, physical therapy. It took me 42 doctors to misdiagnose me before the 43rd doctor got it right.
42
And that was a 3-year process. And then it was another 4 years before I even got a proper treatment that helped treat me in a way that could help me manage my daily living. So during that time, I had surgeries that had complications. I had one doctor diagnosed me with thoracic outlet syndrome due to the swelling from the RSD. I was rushed into having a rib removed. When the doctor did that, he made a mistake. He left the bone spur going into my lung and another bone spur wrapped around my brachial-plexus nerve bundle and caused 5 lung collapses. One was a major collapse. I had internal bleeding from complications of medication, tumors growing in my mouth. I started developing kidney stones. Everything that could go wrong went wrong. And so I had to figure out how to become my own best advocate. And once I started doing that is when I started getting better treatment, when I started researching and not just jumping into whatever was offered, but figuring out if this was the right thing for me really made a difference in my life.
Okay, so 42 doctors misdiagnosed you.
Yes.
One of these doctors who misdiagnosed you made mistakes during surgery. Was this surgery unnecessary in the first place? And then on top of that, mistakes were made that caused further complications?
Exactly right. I did not need the surgery in the first place, but I didn't research for myself. And basically, I was told it was a vascular surgeon, and he said, you are going to die if you do not have this surgery. And he scheduled it within 5 days. And I didn't stop to question. I was just in so much pain that I rushed into surgery and then had major complications. I had to have a lung surgery. I had the 5 lung collapses. One was a full collapse. The other 4 weren't as severe. They are called pneumothorax. I kept telling him something's wrong, that, this doesn't happen. And he would say, well, some people after surgery have spontaneous lung collapses, and so it could take up to 6 months to realize, that wasn't what was going on. I would try to tell him from the beginning, something else is wrong. I'm worse now than I was before surgery. My pain is worse. It's spread. I'm not doing well. And he didn't want to admit that he did something wrong. I ended up seeking another provider who did a 3D CAT scan of my body and said, I know what the problem is. And he gave me a picture of it and said, this bone spur is going into your lung. That's why your lung keeps collapsing. This one is tucked around your brachial-plexus nerve bundle. That's why your pain is spreading. And so, and then the first doctor came back and apologized and said he was sorry, and he retired shortly after that. But it's a mistake that happened when it wasn't even a surgery I needed.
Now, you talked about this auto accident, reflex sympathetic dystrophy.
Mm-hmm.
Is it caused by an injury, or is it something that develops over time, and then all of a sudden you've got this flare that doesn't stop of pain? How did it come about? When did it first start?
Okay. Well, in 2011, there was studies that came out saying that it's autoimmune disease, and they can find it in our blood. Other countries have blood tests for it. It's just not available here in the U.S. yet. But at the time of the accident, I didn't know that. And so what I'm told is your body is primed by injuries, and then it's like somebody slaps you across the face. The first time they slap you across the face, you're shocked. You're like, what's that? The next time somebody walks up and slaps you across the face, your body starts to protect yourself and say, I'm not going to let that happen again. Well, that's kind of what happened with I went through endometriosis, and then I had a knee surgery due to a cheerleading accident. I got better, after that knee surgery. The next year, I had this auto accident, and that knee surgery was if somebody slapped me. The auto accident was basically my body was already primed, and I have these 2 autoantigens in my body, so they triggered, and that's what makes it chronic. That's what makes it something that becomes long-term versus something that's short-term.
Okay,
also, not having proper treatment in such a long, that 3-year period exacerbated everything that was going on.
So is it basically RSD is like turning the pain switch on and basically leaving it on?
Correct. Yes. Once the autoantigens in my blood are triggered, to get them to turn back off is very difficult. And so basically that's what makes it become chronic. In 2009, 7 years after I developed RSD, I underwent infusion therapy that actually put me into remission, or a state of remission, that I went from a wheelchair to walking in a 7-day period.
That quick,
getting the right treatment. But I did so many wrong treatments leading up to that it spread full body, and it put me into a wheelchair with dystonia. My arm and foot curled up. The infusion therapy helped with the dystonia. It helps with the chronic pain, and it's a burning fire pain. And I also have other pains like sharp pain, electric pain. Those come and go. The burning fire pain was all the time.
As an athlete, obviously you've dealt with pain as a cheerleader. You've hurt yourself. You sprained ankles and whatnot. Being an athlete,
right.
What type of awareness of pain and pain treatment were you familiar with before this? I mean, as an athlete, were you used to using just heat, cold therapy, or were there painkillers involved?
There wasn't painkillers involved, except for when I tore my meniscus and patella tendon, and when I had that surgery, I had to have pain medication, but it was for less than a week. It was a very short acting time. So, I had it right after surgery and for a few days and was done with it. After I developed RSD, I did not want to take opiates for long-term use. And I was taking an NSAID and for over a year, and I developed internal bleeding from taking an NSAID and realized, okay, this is not something I can continue to do. I need to switch to opiates to help protect my stomach from the bleeding ulcers. So I did end up switching to it long term, but prior to, as an athlete, I would elevate, rest, use ice, use heat, and went with those types of approaches. And also chiropractics, and we had team doc. I was, coaching on a university level, so we had team doctors that were there. And anything that happened to anybody, We had trainers at our practices. We had team doctors that we could see for free, and everything was taken care of. So really, I wasn't aware of any long-term type care needs, only short-term care needs. And when I had now if I went back and coached at this point in my life, I would be a lot more cognizant of the things that happen with chronic pain. And when people were complaining over a long period, instead of saying, suck it up, go get a cortisone shot and wrap it and get back on the field, we need you, I would have stopped and paid attention so that they could have got the help sooner. And, I'm really sad that I wasn't aware and didn't do that as a coach. So hopefully sharing my story will help other people that hear this, understand that there's a difference between acute pain that's short-term, that can be taken care of and you heal and you get better, and then injuries that are long-term, chronic, whether it's a disease or an injury that leads to a chronic pain condition. It needs to be treated differently.
And where can we get more information about your foundation and about you as well?
You can get more information about Power of Pain Foundation at powerofpain.org. And you can get more information about me and my personal story at barbyingle.com.
And that's BARBYINGLE.com, correct?
Yes.
Great. You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been talking in studio today with Miss Barby Ingle, a sufferer of RSD, Reflex Sympathetic Dystrophy, and also endometriosis. She's a chronic pain educator, a patient advocate, and also a motivational speaker and best-selling author, as well as president of the Power of Pain Foundation. We've been here talking about some of the obstacles that one faces when they suffer chronic pain due to simply a misunderstanding of what chronic pain is and how to quickly identify it and thereby treat it. It's been great having you here with us today, Barby.
Thank you so much.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.